before we get into this, I mean, you would expect this for the topic, just a bit of a trigger warning. I am going to be talking about cancer, but I'm going to use the word cancer a lot, and we're going to talk about some specific cancer groups as part of the work that we're doing. But I am going to present this in quite an upbeat way, in the sense of what we're actually trying to do here is proactive and positive for people. So yeah, and I've underlined the word "we" there, because it's like how we built a social movement to make cancer everyone's business. I'm sitting here from Eski. We've had a part to play in this, and obviously the stuff I'm going to talk about is the work that we've been more directly related to. But the "we" is lots of different people, and if I look at who's joined us on the call here, I can see Claire's here, I can see Catherine's here, I can see Mabin's here. The people you might pop up in the throughout this presentation, because you and other people who I might have missed off the list there have been collaborative here, because it is about a social movement I'm talking about, not just a campaign, although there are elements of campaigns, as I will explain. Okay, so South Yorkshire and Bassetlaw shows up. Effectively, what this is a social movement, as I mentioned. It's designed to engage and involve all communities and workforces in some bold ambitions to improve the cancer outcomes across South Yorkshire and Bassetlaw. It is probably better illustrated by me sharing a short video which we released on World Cancer Day last year, which will give you a flavour of the collaborative working.
We live in an amazing place.
Although something isn't right.
South Yorkshire and Bassetlaw has one of the highest rates of cancer in England,
with the lowest proportion of us diagnosed early.
We deserve better.
That's why we're calling on more of us to show up for each other.
Showing up means taking steps in our communities,
our workplaces,
our education,
throughout our own lives.
It means innovation,
compassion,
doing things differently,
doing better.
Together, we can turn the tide on cancer.
By showing up, we can reduce the number of deaths from cancer,
reduce inequalities,
level the playing field
by increasing access to testing, treatment, and care.
1 in 2 of us will be affected by cancer in our lifetime, and better treatments mean we're living with cancer for longer.
We need to see cancer as a long-term condition
and give each other the support we can to live in this amazing place.
We show up!
We show up!
We show up!
We show up!
We show up! We show up!
South Yorkshire and Bassetlaw shows up.
It's who we are.
It's what we do.
And we all have a part to play.
So we need to talk about we. So who is this? Who is this partnership? Well, the lead partner in this is South Yorkshire and Bassetlaw Cancer Alliance. You've all got your cameras off, otherwise I'll ask you to give me a wave. A few of you are on the call. Thank you very much, Charlie. If anybody wants to drop positive things in the chat all the way through, keep going for it. Anything that's a bit more challenging, leave it till the end. But yeah, it's great to kind of embody that. Now, it doesn't tell you any details. It doesn't give you any kind of. It doesn't set out what the strategy is and the targets. It's about a feeling, and I think that's something that I'm going to keep returning to across the course of this morning. And the Cancer Alliance recognise that whilst obviously this is their day-to-day business, it's not just the work of the Alliance to try and tackle the health inequalities of cancer across South Yorkshire and Bassetlaw. There are organisational level work going on with proactive work from Western Park Cancer Charity, South Yorkshire Mayoral Combined Authority, South Yorkshire ICB, the public health at the different councils that make up the area. And there's initiatives that we've partnered with in various ways, like Barnsley, Whale at Work, the cancer champions that they have there. But as much as organisations do that, you've got people as well. So so I see Mabin's on the call here. So Mabin from Rotherham Hospice. Now, we haven't spoken for a while, but you got in touch very early on and just said, basically, where's the effect of, I've seen what you're doing, this is what I'm doing, how can I help? And I think that's just, it's indicative of what the cornerstone of this work is. And then we've also seen that in specific sectors. So, for example, in education in Sheffield, we've had Maxine Johnson at Sheffield College has been involved in lots of different ways, has hosted our events, has given us advice on engagement with employers, engagement with young people. And a really great example is, and I'm not just saying this because your camera's off, is Kath Holbert with a colleague, Emily Newton, at the Advanced Wellbeing Research Centre, who have again got in touch with us when they've seen what we were doing, and they've helped us put events together, they've created resources, they've given us contacts, they even gave us space to work from. And this is people who are choosing to do this. Yes, it's part of their job, but they don't have to do it. And it's extra work for no extra money, and other than a name check from me every now and again, probably not a lot of extra credibility. So this is something that people have opted into, and it's really inspiring to see that. And other than being nice people, you have to think about, well, why do they do that? And I think that sort of that it's important, that sort of emotional connection is really what that's built on. And I'm going to set this up with I'm going to show you 2 minutes of a longer video, setting the context. We've got Dr. Louise Merriman, who's the clinical lead of the Cancer Alliance, and then members of the People Affected by Cancer Advisory Board.
Now, 1 in 2 of us will be affected by cancer. We'll either have cancer or we'll know someone who has cancer. And, equally, we will see people survive their first cancer and go on and get their second cancer or even their third cancer. So it's everywhere, and therefore it has to be everyone's business.
Cancer affects not just the patient, it's the carers and everybody else that's around and in that support network as well.
Cancer is for living. You live with cancer. You make your life. Because someone is positive, someone is negative, so we don't get the same thing. But then to improve it, we all need to talk, and this is what we're here for.
So I think there's no doubt about it that between screening and guidelines for health professionals, and also social media campaigns, we are making people present earlier. We are seeing people hopefully with earlier stage cancer, and treatments have advanced a lot. So we're managing cancers, more people are surviving their cancer.
I think we're massively developing and learning all the time. And I think within our communities and speaking with other people and other families, I'd like to think we're all becoming a little bit more aware and sensitive to the subject. And here we massively talk about how we need to improve the environment and to work on support systems for patients and families and the whole ripple that's affected by cancer.
It's important to get across to people, cancer doesn't need to be a taboo subject. You've got to speak about it, especially I'm from ethnic background, and it's very taboo. It's not spoken of. That word's just like really, really hush hush. But we need to talk about it. We need to shout it from the rooftops, because people now live with cancer. It's not a death sentence anymore. Treatment's come on a long way, so we're here to try and make a difference.
There's a longer video for anybody who hasn't seen that one before, if you go to the show's YouTube channel. And this, I suppose, comes to our first lesson learned from this, is that emotion and lived experience means so much. So the conversation I have quite a lot is when we talk about long-term health conditions, is cancer a special case within that? And I think, yes, it is. And every other long-term health condition is very serious, but it's just the reaction that people have to it. And maybe that's down to the prevalence that 1 in 2 of us, as we said within the video, will experience it in our lifetime. And that connection is there. And the Cancer Alliance know this, which is why they have PABCAB, who we've just heard from some of the members there. And Mervin's put it up in the chat already. Why do people show up? Because we should and we can, and it's as simple as that. And that is probably more simple than the slide we prepped on this. But why do we think people show up? Because there is that emotional connection. Every one of us on this call has been affected by cancer. We're probably thinking about somebody when we do it. So once you've got that, it builds that driver in you that enhances your motivations, but wants to be proactive on it. But you've got to give people the opportunity. I've mentioned some cases of people just coming to us and saying, I've seen what you're doing, how can I help? Other people we have asked, and it does feel like you're pushing on an open door a lot of the time. People bring expertise to that as well, so they feel like they want to make sure we're doing it properly, which we really do recognise the value from that our style of working is to be like a sponge and to get the right people doing the right things rather than thinking we can do it all. So a social movement is really powerful to do it in that way. And then links to that, as I've already alluded to, people are being asked. Some people don't get asked. We've got so much expertise and passion out there that you have that opportunity to do that. The photograph that's on the bottom of the slide there is a clip from a video that we've not put out yet, but that's Charlotte Killier, who talks about the emotional impacts of late effects of hair cancer. And one of the aims of that is to help people working in healthcare understand how the positive and not so positive interactions that they have affect somebody living with cancer. We can all read about side effects and lists, but actually hearing it and seeing it is just much more impactful, because that way you retain the knowledge, and that's where we start looking at how that can influence attitudes and then ultimately behaviours. Okay, so the second reflection that we've got is around the brand, and this is a bit more of a I suppose a marketing one really. South Yorkshire and Bassetlaw shows up, and it's like, what does that actually mean? Well, it's actually very versatile. So where it began was a social norming message. In South Yorkshire and Bassetlaw, we show up. It's just what we do. We take action, and we're seeing that. And I'm preaching to the converted, because a lot of people on this webinar have showed up. As I say, it's sort of like, well, this is what we do around here. It's versatile in that it shows that we all have our part to play. We've got the sort of we show up, I show up. People can sort of have that opportunity to be empowered. Some people who are doing things anyway and want to just be a part of a collective movement, but others it's inspired new action and activity. It can be tailored through area. South Yorkshire and Bassetlaw is a big area, but you can look at Bassetlaw shows up, Doncaster shows up, Rotherham shows up. So the way that a lot of the NHS work is done by place, so you have that opportunity to do it. And it includes some commitment. We're showing up by, and this is what we're doing. It's a choice. It's even when it's difficult, I show up. And again, it's about trying to embody the challenge that we've got here, but the culture that we have across the area. And really the whole thing around showing up, it's like when we face adversity, a good friend will show up for you in times of crisis, not just when the going's good. So there's lots of connotations around that. It links in with some of the campaign messaging, which I'll explain shortly, but around showing up for screening appointments, showing up for your GP, showing up if you've got a sign or a symptom, showing up for your family, for your workforce. You've heard the word show a lot already. It's not perfect. One of the issues is we do get confusion sometimes with Stand Up for Cancer, which is an initiative from Channel 4 and Cancer Research UK. But even when the times we've just pushed through on that now and got that sort of that recognition, because once you do that, you've got that action, but it needs to have some substance behind it, which is why it's not just a slogan. There is an actual strategy that sits behind it with 5 bold ambitions that have been carefully selected and a part of a program of activity. Because once you've got that substance as well, you're looking for that collaboration. So it had a launch event, it's had place-based meetings with some of the people on this call have been explaining to people what this is, that kind of stakeholder engagement. And there's an opportunity then to pledge to say, I'll show up at that individual organisational level, as I've mentioned, which will then lead to action. And there were multiple initiatives that form part of the strategy, part of shows up as a social movement around investment, treatment pathways, learning and development, and different support services. But what I'm going to do for the remainder of this webinar is focus on 3 of the initiatives that my team and I have been involved in, but we've worked with partners on as part of Shows Up. So the first one of these is a campaign. So we wouldn't describe Shows Up as a campaign, but it has a campaign within it. And what we did is very early on in this is we worked with the Cancer Alliance to define cancer groups where we could make a significant gain to people's health if cancer were detected at stage 1 or 2. So we researched awareness, attitudes, and trying to understand, particularly around those early signs, what are the barriers to presenting to your GP. And and there are a lot, and we haven't got time to get into them now, and some of you have done work in this area. But one of the things that we focused on was the fear of that. So we built a behavioural framework around that using East, which is probably the most straightforward one, and it's around the whole ethos of peace of mind. I'm going to show you a video in a moment which will sort of illustrate it, but it's about making it easy. It's easy to contact your GP. Your GP wants to see you. It's about making it attractive. So it's not about come along and find out if you've got cancer. The whole concept of peace of mind is the chances are you'll be told that you're all right. And that was something that tested well, and it's something that we rolled out. It's social. It's just something that we do around here. If you've got the symptoms, you go and get it checked out. So the idea is it's conversational. There's elements of this around bystanders, around encouraging people to say, I've noticed you've had that cough for 3 weeks now. You probably should go and get that checked out, but in a way that doesn't induce fear. And it's just like, that's just what you do. Your GP wants to see you in that kind of situation. And it's timely with that message that go now, because the sooner the better. So I'll just share now a short advert example.
Having problems swallowing, suffering from pain in your throat or in the middle of your chest, a hoarse voice. If you're experiencing these symptoms, your GP wants to see you for a peace of mind check. These could be symptoms of esophageal cancer. Chances are it'll be all right, and these can be symptoms of many other conditions. But if you do need treatment, the sooner the better.
But the lesson learned on this is about how we use the data. Now, I mentioned earlier that we obviously there's heaps of data that's available to understand where in the different parts of South Yorkshire and Bassetlaw there is a prevalence of different forms of cancer, where there are health inequalities and where we're not picking up the cancer at stage 1 or 2 early enough. And we did run that across the area, ran a digital campaign. There's some stats on the screen there around the reach, which was 1.7 million, leading to over 100,000 people coming in and picking up the information on the website, and then lots of other interactions online. But and that's good, and you can see that, and you can start looking back 2 years. You can actually see, well, did we see any changes of behaviour in terms of presented to the GPs in that time frame? But now we're being a bit more sophisticated with it, and we're looking at the particular data and how we can marry that up with other activity that's happening. So we're working with Karen Levers, who's the programme lead for inequalities and early diagnosis, to test and refine that original campaign. And does it work for more diverse audiences? Does it work for other messaging, for example, around screening, and how we actually are going to engage that with the community? So we're exploring how this can sit as an overarching campaign, but smaller campaigns that marry up with the work that's happening by the voluntary community sector, who are actually going to go into an area, work with targeted communities and do some face-to-face education. And when we know when that's happening, we can nose out. Digital campaigns are easy to target, really, because it's all about picking stuff from a map and choosing how much money you're spending and what messages and how you get it out there across different platforms. We're going to partner the two things together, so they'll get pre-messaging before the community engagement, messaging during, and the messaging afterwards. And we'll evaluate this and hopefully come back to you in a couple of years' time and be able to share the learnings from that one. So I guess what I'm trying to say is that we've always been informed by data, but now we're even more informed by data, and the only way that's going to work, because that's in the execution, the only way you're going to work is if it resonates and it works with your community. So you still have to do that proper behavioural insight work first to make sure it's going to land. So the fourth lesson, this is quite a practical one, really. One of the targets that we had was around working with young people, and so again we did our research, we did some workshops with schools, with young ambassadors. We had a fantastic event with young people and professionals together, where we learned a heck of a lot about what do people think about this, where are the opportunities, and where do we need to prioritise. So the main opportunity around this was originally around reducing taboo. It was mentioned in the video earlier. Somebody said that, look, I'm from an ethnic minority background or an ethnic background. We just don't discuss this. So we looked at kind of what could we do here, and we looked at the opportunity to do some intergenerational learning. So if you've got young people learning about cancer through education? Are there any transferable skills that can go back into the home that could go to parents, grandparents, carers? And that's kind of where we started, and that led then to the development of some educational resources, which are excellent, and they are available and they are being used. However, anybody that works with schools, particularly around health or prevention campaigns, will know it's really difficult to get into schools because everybody wants to get into schools. So we hadn't cracked it at that point. There was more work to do. So we made it available. We promoted the fact that it was there. It's something that you can pick up and self-deliver. There's assemblies, there's classes. It's a great resource. Have a look on the hub if you think it would be useful. But in terms of how that was implemented, we had to develop partnerships with existing work that was being delivered in schools rather than just introduce this as something new. So, for example, we worked on, in terms of HPV, we worked with the immunisation service, we worked with Children and Young People's Partnership, and we partnered with Fairvale School in Sheffield, who have a strong population of the Roma community, where there's a lot, but the HPV vaccination rate was much lower. So it's just like, well, let's start here and let's build it up. So we co-produced some films with young people there talking about what it is, and they were able to quiz immunisation nurses and GPs around vaccination and what it means and what side effects, and dispel some of the myths around that, which was a really powerful piece, which has been rolled out by Western Park Cancer Charity as part of their community engagement work. So it's not a case of we've done this work, it's up on the website, it's done. We've got to look at how you keep implementing that. And the other thing is we reflected that our target audience was young people, not schools. So we had to look at the different ways of reaching young people. And I know there's going to be a law change on this, but we looked at what work we can do around social media. So we've looked at repurposing the materials there, creating new ones. Young people is not a homogenous group, and you don't just reach them through one channel. You have to be really versatile with that. So we've always looked at the storytelling element to this and how you can connect with people. And one of the things that we realised, and one of the pivots that we made, was our definition of young people. So whilst we started off at secondary school, we actually then expanded this into young adults, because we found, particularly at that workshop that I mentioned earlier on, there was Rose and Natasha and a few other young people there who had really compelling stories, and that's what other young people would relate to. It's young people who are a bit older than them, or who they will relate to. They'll understand the story and what they're going through, and they can still learn about cancer, and we can still have that learning that they can take into the workplace. So, but it would be just much more powerful. So we produced a documentary called Cancer Unfiltered, which was co-produced with young people telling their stories. We tested it in Sheffield College, and now it's live and it's rolled out, and it's very emotional, but it puts young people at the heart of that story. So we're always on a bit of a journey with this one. But one of the things is always sort of like work with your target audience, and they'll tell you. And it's okay to pivot on these things, because we've been given time to develop it, and we've got a great client and partnership relationship for us to adapt. Okay, so into the final lesson learned was around employers, and this is a piece that's I've been quite heavily involved in myself, really, because where this comes from is that nearly 1 million people of working age in the UK are living with cancer, and in South Yorkshire and Bassetlaw, half of all of the new cancer diagnosis will be people of working age, and sadly we have got some of the highest cancer rates in England. The idea here around working with employers is actually to sort of, again, like we did with young people, is sort of create the conditions to put them at the front of it. Now, there's all kinds of reasons why employers would do that. There's things around, if you detect cancer earlier, there'll be less treatment required, therefore your retention will be higher. But what we found is, again, people just want to do the right thing. And certainly, speaking with larger organisations who are proactive, want to be more proactive, have a lot of structures in place. But your smaller and medium-sized organisations, whether that's private sector, VCS, or even public sector, they want the confidence to do that. So what we've done is we've built a really strong community of employers who have pledged to show up. They represent over 50,000 employees across South Yorkshire and Bassetlaw. That is where it was some large employers who do employ thousands of people. But their head of people, their occupational health, their teams have come forward to help us to get this right. The pledging idea itself is, although we made it easy to do that, and we've seen some reluctance because people don't want to pledge because they don't know what they're committing to sometimes, and some people don't want to pledge until they know they're actually going to do it properly. So I don't just want to do a tick box exercise. Let's get this in a line. But we've got a good critical mass of people and organisations that we're working with who haven't technically pledged, but they want to do it. So we're exploring whether we keep that going or whether actually we've built our social movement, which was the goal here, and then we keep running with it. In terms of what we do, we have community meetings where they get early access to resources to give us feedback, test it to make sure it works. We have webinars. We had a webinar last week, which is about compassionate communication, which was really well attended. And we've got a specific working group on how we upskill manager capacity when it comes to cancer. So there's a lot of activities, and we're looking at how we plug this in with other employer initiatives around health within the area. Very quickly, this is what the digital hub that we've created look like, and the idea here is that as an employer you can go on there and look at the whole cancer journey and look at tools and resources so that you can implement. So Catherine and team have put together some work around active workplaces. We've put together some internal training around signs and symptoms, and this is actually having a revamp over the summer, and September we're going to go out and test with additional resources and how we integrate AI as part of this, so that you can use it as a guide to actually take you through that process. I could spend half an hour talking about employers. We haven't got that time because we're drawing to a close now. So in terms of the lessons learned, there's a recap there. I'm not going to read the list of things I've already told you. Instead, with my 2 minutes that remain, just going to reinforce this thing around the values that are required to create a social movement. Now, there's probably very little that I've said that surprises you, because you'll be like, yeah, of course you need to do that. But knowing something and doing something isn't always the same thing when you're busy doing lots of different things. But we've been afforded this opportunity by the Cancer Alliance and partners here of great leadership. And what they've done is they've created around this and said, look, we're lead partner in this, but it's not all down to us, and respected other people's knowledge and expertise, which has empowered more great leaders, including people I haven't name checked as part of this presentation. But there's just so much activity going on because of the conditions that have been created. Ask people to show up, and they will. Allies are all around you. They do work at different paces, particularly when working cross sectors. So sometimes I'm quite impatient, but we've got there with some other things, and it's been worth doing things properly. And a movement itself requires continuous improvement and action. So you can't just do one thing, sit back for 3 months and then go, should we look at this again? It's every day. And I would say on average, I get at least one message a week saying, I've just come across what you're doing here, how can I help? And it's about trying to channel that energy and knowledge to the right people, because it's not Eski aren't doing all of this. As I say, we're a part of it for anybody that joined late. And I'm only talking about it from our perspective, but there are so many other people involved in making this happen. I suppose the last thing is that it's not easy, and anything worth doing will be hard, and it takes time. So we're on a journey. It's a long-term strategy, but in the meantime, these initiatives I've highlighted and others continue to try and improve the health outcome for people across South Yorkshire and Bassetlaw. Right, so that wraps up the formal part of this webinar. I'm going to stop the recording now. And